describe it, how to name it. Then come to the description. Description, the lesion. I want to describe it. Okay, under description, right. Under description, write one. Under description, you write number one, the density of the lesion. Yes, can you close the mic? Somebody is laughing. May concentrate on the explanation. So under the lesion, discussion of the lesion, number one, you describe the density of the lesion. Density of the lesion. Density of the lesion. So is it hyperdense? Is it isodense? Is it hypodense? So hyperdense when the lesion density is more brighter than the brain parenchyma. Isodense when the density of the lesion same like the brain parenchyma. Hypodense when the density is lower than the brain parenchyma. Okay, so hyperdense, isodense, hypodense. Okay, so hyperdense like this one, it is hyperdense because brighter than the brain parenchyma. So the density is here hyperdense. Hyperdense. Then number two, okay, the shape or the characteristic of the lesion. Number two under description, the shape or characteristic of the lesion. Like what? Like this one, hyperdense biconvex with convex inner margin. So this is a description of the shape and the characteristic of the lesion. If, for example, mass or nodule, you can say round. In subdural hematoma, you can say crescentic with concave inner margin. But this one, the shape is biconvex with convex inner margin. So you can describe the lesion, regular, round, whatever. Okay, the shape of the lesion. Number three, under description, okay, the location-wise. Location-wise, where is it? So that's one, biconvex, hyperdense, biconvex in shape with convex inner margin, seen where? Seen in the right parieto-occipital region. Right parieto-occipital region. We are not at the level of temporal, just here. Temporal, if you see Selfin fissure, okay, you can say temporal, but this is at the right parieto-occipital region. So location-wise. Location-wise, under location, you can give the location according to the regions, like this one, right parietal occipital, or right frontal, or right temporal, or right cerebellar. It depends on the location. Okay. Or according to the specific location. Specific location could be right caudate nucleus, right internal capsule, right basal ganglia, like that. That's specific location. Okay. Or bones. That is a specific location. So location, you can give it according to the regions or loop, or according to the specific location. But when you give the location, the first thing to say, right or left. That means, is it within the right hemisphere or left hemisphere? Correct this one? Right. That means within the right hemisphere. But where is exactly? Right parieto-occipital region. Like that. Okay. For example, if it is in the right internal capsule, where is it? I'll say right internal capsule. I will not say just internal capsule. No, you have to say right or left. So you have to specify where is it? Is it in the right hemisphere or in the left hemisphere? Then according to the region or according to the specific location. So this is a number three, I think, the location. Number four, then under number four, you have to say the positive mass effect. Any occupying lesion definitely will be having positive mass effect. So under positive mass effect, you have to look for these points. First, A, is there any midline shift or not? Yes, there is a midline shift. And if there is a midline shift, to which side? Is it to the left or to the right? So here it is to the left side. So there is a midline shift to the left. Then number two, under positive mass effect, do you see the ventricles at the same side? Is it compressed or not? Yes, the right lateral ventricle is compressed. So number two, the ventricles compression of the ipsilateral lateral ventricle. Okay. So number two, you check for the compression of the ipsilateral lateral ventricle. That means the same side ventricle, you see whether it is compressed or not. Number three, the contralateral ventricle, you check whether it is dilated or not. Not all the time is dilated, but many times it will be dilated. Why? Because when there is too much midline shift, you know whatever excreted by the choroid plexus, CSF choroid plexus at the left side, so it will be blocked. Why? Because there is too much midline shift, and the foramen of Monro, which connects the lateral ventricle to the third ventricle, it is blocked. So that's why the contralateral ventricle will be dilated, because there is a blockage at the level of foramen of Monro, where the normal flow of the CSF, it will be go through the foramen of Monro to the third ventricle, then to the fourth ventricle. So that's why sometimes it will be dilatation. Okay, but not all the time. So you have to see it whether it is dilated or not. Number four, you check the cortical sulci. Cortical sulci, it will be all in all slice. How to check? You see with the opposite side. If you see like this one, you can see the cortical sulci a little bit here and here and here, because this is young patient, and young patient always the brain is tied to the skull, and the cortical sulci, it will not be prominent, but you can see a little bit here. I can see it in the left side, but here it's all effaced. So I can check, okay, effacement of the cortical sulci of the right frontoparietal region. Okay, right frontoparietal region. There is effacement of the cortical sulci of the right frontoparietal region. Okay, then if I am at the level of self-in fissure, I have to check. If I see on the right, in the normal side, if I can see it here, but I don't see it here, then I say effacement of the cortical sulci. If I am at the level of any basal assistance, then I check for basal assistance if it is effaced or not. So under positive mass effect, this point you have to look for. All of you right. Under positive mass effect, you have to look for this point. Is there any midline shift or not? Is there any compression of the ipsilateral ventricle or not? Is there any effacement of the adjacent cortical sulci or not? And is there any the contralateral ventricle is dilated or not? Do I see the self-in fissure is effaced or not? I check the basal assistance. Do I see effacement of the basal assistance or not, or compression, effacement or compression of the basal assistance or not? So all these points I have to look for whenever there is a Cobain lesion. So this is the signs of positive mass effect. Okay. Then this is number what? Number 4 or what? The point under description. If it is number 4, number 5, we check for any other focal brain lesion. If there is any other focal brain lesion. If there is any other focal brain lesion like mass, like nodule, like bleed in other area. If nothing there, also I have to see the scalp trauma case. I have to see scalp. If there is any scalp hematoma like this one, there is scalp hematoma. So this is number 6. You see for scalp hematoma. Okay, this is how we describe it. Then after that, I want to give the diagnosis. How to give the diagnosis? All of you listen how to give the diagnosis. So when you give the diagnosis, under diagnosis number 1, you say the location. What is the location? Right or left? Region or specific location? Okay, right or left, or according to the region or specific location. So then the type of the lesion. Number 2, the type of the lesion. So like this one, right parieto-occipital epidural bleed. So I say right, the region, parieto-occipital, the type, epidural bleed. So this is right parieto-occipital epidural bleed. That is the location. That is the diagnosis. If it is subdural bleed, I can add the face. If it is subdural bleed, I can add the face. Okay. So see how now I'm going to describing. Okay, after I read the history, I make sure, check the data is correct, fed to the correct patient. Then I want to name it now. I'll say this is plain axial CT scan of the brain, shows there is hyperdense area, biconvex in shape, with convex inner margin, seen in the right parieto-occipital region. There is midline shift to the left. The right lateral ventricle is compressed. The contralateral ventricle is dilated. The cortical sulci of the right frontoparietal region are effaced, and no other focal brain lesion. There is scalp hematoma seen in the right parieto-occipital region. Diagnosis: right parieto-occipital epidural bleed. Why epidural bleed? Because it is limited by the sutures. It is by coronal and lumbar sutures. It is occur between the bone, the inner tip of the skull, and the outer layer of the dura mater, which is the prosteum layer. That's why it is attached to the sutures. That's why it is limited. It's cannot extend beyond the sutures. So it is arterial bleed. Okay. So that is how we describe it. All of you write in your logbook. Plain axial CT scan of the brain. Plain axial CT scan of the brain shows there is a hyperdense area, biconvex in shape, with convex inner margin, seen in the right parieto-occipital region. Seen in the right parieto-occipital region. There is a midline shift to the left. The right lateral ventricle is compressed. The right lateral ventricle is compressed. The contralateral ventricle is dilated. The cortical sulci of the right frontoparietal region are effaced. The cortical sulci of the right frontoparietal region are effaced. No other focal brain lesion. There is scalp hematoma seen in the right parieto-occipital region. There is scalp hematoma seen in the right parieto-occipital region. So diagnosis, right parieto-occipital epidural bleed. Right parieto-occipital epidural bleed. Okay, can you